Brittany. I'll be your level 1 student nurse today. Could you give me a quick SBAR report?
Sure. Hi, Brittany. I'm Krista. Okay, so let me wash my hands here. The patient today is Glenn Light. He's a 67-year-old male. He just came in today, and he has no known allergies. He is a full code. He has medium risk for fall. He did come in with an ulcer on his right heel. He's had that for about 3 weeks now. It's not healing. He's diabetic. He's type 1 diabetic. He's had that for about 20 years. Some of his background, he has had a transurethral prostate resection about 5 years ago, and he has a history of anxiety. His LOC, he's alert and orient times 4. He does activities as tolerated. He isn't feeling anything on the bottom of his foot in his lower extremities. He says he has a pain level of 1, but it is worsening. He has full range of motion, and his breath sounds are clear and unlabored. He doesn't have a cough, and he's breathing at a regular rate and rhythm. His pulses are palpable. He doesn't have any clubbing or any edema that we've noticed. His abdomen is flat, symmetrical, soft. He doesn't have any pain or tenderness. He is using the bathroom regularly. He says he has no diarrhea or constipation. He is on a restricted diet, 1,800 calorie diet with 2 grams of sodium restricted. He doesn't have any painful urination. Let's see, his vitals, his last blood pressure was 128/70. He was breathing at 60% room air. His heart rate was 76 and his temperature was 98.4. The reason we're here today is he had a high blood sugar of 290, so we're going to give him some medication for that. He is on simvastatin, gabapentin, NPH, insulin, and also morphine, as well as the Lispro. His labs all came back pretty good except his high sugar. That's really about it.
Why specifically is this client receiving this medication, and what action does this medication have on the body?
Well, Glenn's receiving this medication because he's hyperglycemic. His glucose came back 290, so we need to give him the insulin because he's type 1 diabetic. He doesn't make insulin. So this insulin will help get the sugars into the cells and restore the fats. And it's a rapid-acting medicine, so it'll start working in 5 to 15 minutes, and it'll take anywhere from an hour and a half to peak.
When should you question administering this medication?
If he's hypoglycemic, if his blood sugars are too low, or if he's had any allergic responses to it before.
Does this medication have a therapeutic serum level?
No, it's just based on the patient specifically.
What vital signs must be monitored?
I would definitely pay attention to his temperature, especially because of the wound, his blood pressure, his pulse rates.
Which physiological parameters should be monitored when the medication is being administered?
Checking his glucose levels and the A1C.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to teach the client to rotate the sites, to always check his glucose levels before he gives himself medication, that he has food that he's either already eaten very recently or will eat very soon after. Make sure there's no irritation, redness, swelling.
What interventions must be taught for taking the medication safely at home?
Basically the same. He needs to make sure that he always has food, that he's administering the needle at the right angle, checking his glucose levels, not having any anaphylactic reactions.
What are the side effects and potential adverse reactions?
He can get hypoglycemia, so too low blood sugar. He can be dizzy, get blurred vision, if he has trouble breathing, anaphylactic shock or insulin shock.
Okay, and last, how will you know the medication is effective?
When his blood glucose levels drop, the goal is to get it in a range between 70 and 120. Okay, alright, so we're going to give him some medication, so I'm going to make sure I wash my hands. Hi Glenn, I'm Chris, I'm going to be your nurse today. We're going to give you some Lispro insulin for your high blood blood sugar levels. Is that okay with you?
Yes.
Okay. And you are Glenn Light. And can you tell me your date of birth?
I'm 67 years old.
All right. So come here and I would check my medication when I pulled it out of the Pyxis, making sure that it's Lispro insulin. And we're going to be giving him 6 units, so I would check my MAR. I'm going to make sure it's the right time. It's supposed to be given at 1700. Okay. 1705. And I made sure he had no known allergies, and I'm checking that on the MAR that he does not have allergies marked. We're going to give it subcutaneously, wherever the patient chooses. Is that okay with you?
Yes.
Okay. And you've had no reactions to subcutaneous injections recently?
Never.
Okay. Well, that's good. Okay, I'm going to check the expiration of the drug, and it is not expired. Okay, so wash my hands. And can you tell me your name and date of birth one more time?
Glenn Light, I'm 67.
All right, Glenn. Check your bracelet, okay? And again, I'm going to check that it is in fact insulin Lispro. And we already did check with the doctor and check the sliding scale that it is 6 units to be given. It's not expired. It's the right patient and the right route and the right dose. Okay. And this here. Actually, before I do this, I'm going to put it in the bar. And we're going to check patient's ID number here, which I have written down. Scan it in. Okay, and we're going to check the medication barcode again before we give it to him. Okay, and it is verified. Green circle came up. I'm going to do my third check that it is insulin, 6 units to Glenn Light and your 67, Glenn Light, and it is not expired, and you're doing it at the right time. Okay, so we're going to clean this again, double check. And where would you like this subcutaneous shot, Mr. Glenn Light?
In my belly.
Alright, okay, so first we're going to make sure that there's air. We want 6 units. And we are going to push the air into the bottle. And can you confirm that this is 6 units?
That is 6 units.
Okay.
So we'll go ahead and draw that out too. And before we give those units and draw those up, we want to make sure that we can't put them in one unit. So we're going to go into the book here, or you can call parentheses either way. And here it says not
Documenting that I'm giving the upper right abdomen.
with his regard gaze with any other instrument. That's very important. So now that I've looked at the time, the route, the amount,
16
the
is
medication,
so
and verify that with the patient, we're going to go ahead and go into the okay? Hey, how are you doing? I'm Corinne, and I'm going to be your nurse today. Let me go wash my hands, okay? Okay. Can you tell me your name and date of birth, please? Okay, great.
Alright,
Go
Mr.
ahead.
Glenn, we're gonna give you a clean here. Double checking Glenn Light.
We have
67.
Jarvis here, and I have his name in
Gonna
here,
pinch
so
the
I'm
fat.
gonna ask him if he has allergies. Do you have any allergies? Okay, good. So in here, I also have a no allergy.
Make sure that it's all the way. Are you feeling any pain or swelling? Checking the site? No? Okay, everything's good.
I'm a nurse.
Dispose of my gloves here.
Okay, you take the temperature.
Wash my hands.
Once you've done to my level. So now that we already checked everything else I needed, I want to make sure that you can get information about your types of tests.
You mentioned earlier that you needed some information on diabetic education. So I got you some information about your diet, about the foods you should be eating, vegetables, whole grains, and fruits. And I also want you to pay attention to the reactions that you may be having, such as the dizziness and the headaches and possible blurred vision. So can you tell me some signs and symptoms to look out for?
Oh, I don't know, blurred vision.
Right, yep, blurred vision, dizziness, and can you name a couple of foods you could eat?
Grains, fruit.
Yep, okay, that's good. Alright, thank you for that. And do you have any other questions?
I do not.
Okay, and I'm going to document.
So here, again, I'm going to take the medication, second time. The expiration date on here as well. So the meds are both okay. Second time.
Okay.
Still within that
Just have a few more questions.
Okay.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I did check his glucose levels. I made sure that the medication was clear and colorless, that he had food with him that he could eat, and I double checked the sliding scale to make sure that was correct.
Did this information affect your decision to administer the medication?
The level of his glucose did, the 290, because that affects how much insulin I give him, and where I put the shot, I wanted to make sure that it wasn't in the same spot as before.
Okay. And did this information affect how you administered the medication?
Just where I put it, and that's about it. Yeah.
Alright, great, thank you.
Thanks.
What's that?